so we'll go ahead and get started. So just a quick agenda for tonight. We're going to go over the background of the issue, which I assume everyone is familiar with, an overview of the proposed rule, and then we have some slides to discuss how to submit, compose, and submit a public comment. And then we'll go over some frequently asked questions, and then we'll have time for question and answer period, and then a little bit of information on how you can contact us for more information. For this, I apologize, I don't know if the chat is available or not, but if you have a question, we need everyone to utilize the question and answer feature. And then when we get to that slide, Tracy will answer those questions. So for now, we'll just go ahead and proceed. So background, as most people already know, under the current law, Medicare's prescription drug benefit, which is Medicare Part D, excludes coverage for medications due to the language that was part of the statute back when it was introduced that states there's not coverage for agents when used for anorexia, weight loss, or weight gain. This exclusion has prevented Medicare from covering any medications for obesity. Now, more recently, they do cover the medications when they have another indication, such as cardiovascular risk reduction, but there's only one right now. So this would expand to include all obesity medications. And currently, Medicaid plans can opt out. So Medicaid, state Medicaid plans have the option to cover or not cover obesity medications, and there's approximately 19 states that do, and they have varying criteria for that coverage. So OAC and our advocacy partners have advocated for over a decade to have Medicare change the interpretation of the statute. And finally, our advocacy efforts were heard, and on November 26th of this year, the White House announced a proposed rule to expand coverage for obesity medications under both Medicare and Medicaid. So a huge advocacy win. And I want to, again, thank everyone who helped make that happen and get us to where we are now. But we're not there yet. So the proposed rule, it proposes a reinterpretation of that exclusionary language on weight loss. And if finalized, medications used for weight loss or chronic weight management for treating obesity would be covered. So CMS, as part of the proposed rule, CMS is seeking comments on whether to include coverage for individuals with overweight and at least one weight-related medical condition. So currently, the proposed rule does not include individuals with overweight because overweight is not a disease. So that reinterpretation of the language would only apply to treating obesity. But again, this is an area that CMS has specifically said they're seeking comments. So if this is an area that affects you as a patient or as a provider, or you're interested in submitting a comment on that, certainly make sure you highlight that in your comment, what your thoughts are on CMS, including the coverage for individuals with overweight and at least one weight-related medical condition. So highlights of the proposed rule. The rule does not define obesity by BMI. We're all well aware that BMI is a flawed indicator of health, especially on the individual level. So again, CMS does not define that. It does state that Part D plans can establish criteria for prior authorization. So, plans might use BMI in that. However, the criteria cannot be more restrictive than the prescribing indication criteria. And so for the medications that are FDA approved, the labeling has changed not to include, several of them do not include BMI in that labeling. It also acknowledges obesity as a chronic disease. It emphasizes that patients will require ongoing therapy for effective treatment, and therefore patients will need continuous coverage for proper treatment. So next steps, as I said, this is just a proposed rule. We're not there yet. Currently, there is a 60-day public comment period, and that ends January 27th, 2005. Public comment periods allow for all stakeholders to provide feedback on the proposed rule. Now, this Part D coverage proposed rule is part of a larger rule. I think there's 700 pages to the overall rule. There's several sections that discuss other topics related to CMS and health policy changes. So This is only a small section of it. I do plan on having those pages, that section available in a PDF so that people can read just that section. You don't have to search all 700 pages for it. Comments can always be supportive and or critical of the proposed rule. Now, we hope that everyone on this webinar is going to be as supportive of the proposed rule as possible. However, I just want to point out there will be most likely people who are submitting public comments that are critical of the elements in the proposed rule. So that is why we need to have as many public comments speaking up in support of this as possible. All comments we read by CMS. Many times when we do advocacy alerts through OAC and advocacy action items, we provide you a template letter with what to say. And, usually they're editable where you can like add a little personal touch to them, but a lot of the text is the same for everyone who submits it. We're not doing that for the public comment periods because we need all the comments to be unique as possible. We will give you a little bit of introductory language to use, more so to make sure you specify what section you're speaking on. But as far as the rest of the comments, we want it to be unique and as personal as possible because these will be read by CMS. Also, quality is more important than quantity. So again, that's why even if it's a small comment or a few, it's better to have a few unique ones than several that are just copied and pasted the same, everyone saying the exact same thing. Now, there can only be one comment per individual or entity. So I know there's some organizations or people representing organizations on tonight's webinar. So organizations can submit a letter, such as the OAC is going to submit an organizational letter on behalf of the organization. I myself, as a patient with obesity, I am going to submit my own personal letter under my name. So certainly, if you are a member of an organization, don't just rely on the organization speaking from you. Please submit your own personal letter. So why you should submit a public comment. So again, public comments play a crucial role in shaping policy by making the voices heard and contributing to meaningful change. We've already seen how our voices have been heard by the fact that the White House, proposed this change. If you read the press release regarding it, it really echoed a lot of the messages that we have sent and we have stated in the past decade. The OAC advocates experts, again, have been instrumental in reaching this significant milestone. And I believe everyone on this webinar, everyone who was invited, has played some role in that, either as OAC or a partner organization. Your voice can help ensure access to obesity care for millions of Americans. And this goes along with the next one. So we're not just talking about getting access for Medicare or Medicaid beneficiaries. This CMS policy will set the standard for other insurances, both public and private. So please encourage everyone, whether or not you are a Medicare beneficiary or Medicaid beneficiary, maybe you're dual eligible, or you're a provider, maybe you don't currently accept Medicaid or Medicare, but certainly you have patients who have private insurance that would benefit if they had this policy set and they had to follow the Medicare standard. So composing your public comment. So again, we're asking everyone to please express support for the reinterpretation of coverage for obesity medications. Share how the proposed policy change would impact you personally or professional, or both. Perhaps it affects you both as a patient and a provider. Be specific and include examples. If you could state the medication you were prescribed or that you would like to be prescribed, or the health conditions that you are suffering with, and maybe if you've had the medications, how it's helping. Be sure again to state that you are commenting on the Part D section of the proposed rule. There is no minimum or maximum length for an effective comment. This goes back to the quantity versus quality. I especially want to encourage patients. I don't want you to feel overwhelmed by thinking you have to have some like completely structured letter. It can be a few short paragraphs. It can be one paragraph. Getting your message and your personal story across to them and why this is important to you, it will be effective. And again, the comment process isn't a vote. Again, one well-supported comment can be often more influential than thousands of form letters. And that's again why we are not providing form letters. We are asking everyone to compose their own unique comment. So key messages that you might include or make sure you touch on is obesity is a chronic disease and patients deserve access to comprehensive care, which includes nutrition therapy, physical activity, behavioral modification, and medical management. And of course, these medications would fall under the medical management aspect of those pillars of obesity care. Patients should not have to develop more serious medical conditions in order to have coverage for obesity medications. And the criteria set for coverage by plans should be similar to requirements for other disease states. So just kind of a sample public comment, like an outline to follow. So again, the what. So state that the proposed, again, the proposed rule is a larger rule and there's several sections. So start that you are commenting on section 1B4, the Part D coverage of anti-obesity medications and application to the Medicaid program. The next would be the why. I support CMS coverage for obesity medications because your doctor prescribed it for something or your patients need these medications. And then tell the how, again, how the proposed policy change would impact you personally, professionally. If you have coverage and you want to continue coverage, if you have coverage and you've lost coverage, if you haven't had coverage, but again, your doctor is encouraging you to try these medications, but you can't afford to pay out of pocket. So just include all those. Next, we have some examples. These are not any specific patients or anything. These are just examples of some of the more common ones we have heard from people. So the first one is a Medicare beneficiary. It started off, I support CMS coverage for obesity medications because I'm a Medicare beneficiary living with obesity and I have a strong family history of diabetes. While my doctor prescribed a GLP-1, but my Part D plan would not cover it because I do not yet have a diagnosis of diabetes. I don't want to wait until my health gets worse in order to get treatment my doctor recommends. I mean, honestly, that is good. You could expand on, the way weight or health conditions are impacting you in other ways. But that is a good, example of why you need these medications. The next one, someone who doesn't have Medicare or Medicaid, but a private insurance plan stating that they writing in support of this coverage because they've been taking a GLP-1 for 18 months. And during this time, they've lost weight and they no longer need to take medications for blood pressure or other conditions that they had. And then they were just notified that their employer will no longer cover this medication. And they're worried about having to stop it and that it will reverse all the health improvements that they've made. So I know these are examples. I know I hear them as people commenting, contacting OAC for help, and we've heard them from providers. There's many different ones we could have listed, probably 4 or 5 other scenarios for the sake of time and getting to the questions and answers and frequently asked questions segment will put off, but we do have one more slide about submitting. So once you have your public comment together, you need to submit it to CMS. The deadline to submit comments again is January 27th, 2025 at 5 p.m. We are again encouraging people to get their comments in by January 20th. Comments can be submitted online via regulations.gov. We will provide step-by-step instructions on how to submit your comment. I mentioned this earlier, comments containing more than 5,000 characters should be submitted as an attached letter. Comments will be visible to others, so be mindful of sharing any personal information within the comment. You will be asked to identifying information after the comment is submitted. There's a space to put the comment, and then they ask you if you're an individual or organization, and they'll ask for name, city, email address. So just watch what you're putting in the actual comment box, but there will be some places where you can state the other. There is the option to submit a comment anonymously. We'd really encourage people, though, not to use that option and submit them with your name and your location, your email. That way, CMS knows you are a person. And we do encourage all individuals living with obesity, healthcare providers and organizations, caregivers, everyone to submit comments on the proposed rule. Again, there might be some people who are not in favor of this proposed rule, and we want to make sure that we flood the comments with the patients and patient stories and providers and really let CMS know why this is important and why they need to finalize this rule. This is just a screenshot of what regulations.gov looks like. And again, I'll be providing the links and information regarding how to do the step-by-step process. And you can just click on the comment and then it pops up a form. There's just 4 or 5 steps to enter their comment, click a couple other answers and then make sure they know that you're a human, and then you can submit it. And I know I've kind of been going quick through this. This is session is being recorded. We will have a video available, and we are having another session in January. So now I'll hand it over to Tracy. Tracy, if you'd like to go and answer some frequently asked questions.
Thanks, Sarah. You did a wonderful job. And thank you everyone for joining us tonight. It's a pleasure to be with you. We've come up with a few frequently asked questions that, since the rule has been released, that have come up in different conversations, whether or not that's with OAC members or with some of the policy discussions that we've participated in. Real quick, though, I do see that Christina had a quick question about the time that the proposed rule is due by on January 27th, and it is 5 p.m. Eastern. But I will reiterate what Sarah said about we are encouraging everyone to actually submit by the 20th. The January 20th is Inauguration Day. With the new administration coming in, officially the comment period is, yes, open to the 27th. However, we're not sure exactly what immediate actions the new administration will take. So that's why we're just kind of, suggesting a bit of a buffer in submitting those comments. So to be certain that they are officially recognized in that way. We don't have any major concerns that they wouldn't be recognized in the 20s. If submitted up until the 27th, there's a bit of an uncertainty for that 1 week period. So that's just a kind of a to be safe recommendation. So when would coverage begin if the rule were finalized? When would coverage begin? It would, as it's laid out in the proposed rule for the Medicare Part D coverage, that would begin in January of 2026. For the Medicaid coverage within the proposed rule, it would begin 60 days after the effective date of the final rule. So a little bit of a difference there. Medicaid plans would have to enact it earlier than the Medicare plans. If it is within the 60 days coming later in the year, coming closer to that January 1st, 2026, then they would effectively both start around January 1st, 2026. If the rule were finalized earlier in the year, it could be as soon as summer of 2025. Again, it all depends on the timing of when the rule would be finalized. And if this provision is kept in the final rule, if it's still included, it is possible that this provision, number 4 of the 11 provisions in the final rule, it's possible they could pull it out. So that's why we're really trying to build the support and make it clear that we want this provision to stay in the final rule. So that's when coverage would begin. How much will the Part D copay be? That would be dependent on each individual's Part D plan, to the level of what the deductible is, what the coinsurance is, what the copay might be, what tier the drug might be placed on, the drugs available in the FDA approved class. So there's a little bit of, it depends based on the individual coverage policy of the Part D plan. We'll also note, though, that starting in 2025 and then, yes, in 2026, the Medicare Part D donut hole is no longer there. So there would be a $2,000 maximum out-of-pocket cap on Part D drug spending for beneficiaries. So that there's also that. Where can I read the proposed rule? It is available either on the Federal Register or on regulations.gov, and Sarah will follow up with information on how to find that. And she also kindly will be compiling the specific provision within the full rule that we want to focus on, that section 4. What about intensive behavioral therapy, or the Part B evidence, for obesity interventions? We have intensive behavioral therapy under Medicare Part B, which is the ambulatory care, right? Unfortunately, this proposed rule did not cover provisions in the Part B side of Medicare. So this proposed rule does not include IBT for obesity. And that will have to be addressed in another regulatory action or legislatively. Part B is part of the Treat and Reduce Obesity Act, which is our last mention there. We are also advocating through the regulatory process directly with CMS to update that coverage determination as well. So we have two advocacy tracks going at the same time to update that section as well. But it is not included in this proposed rule that we're focusing on tonight. And then lastly, what about the Treat and Reduce Obesity Act? So we made tremendous progress with the Treat and Reduce Obesity Act in the 118th Congress. This Congress is now coming to a close. The amended version of the Treat and Reduce Obesity Act that was passed out of the Ways and Means Committee in the House was not included in the end of year funding package that Congress is literally still debating tonight and through the end of this week. In the continuing resolution package, it was not included in that, which is actually from a policy perspective our preference, because there was some concern that the more narrow version of TROA, if it were to pass, that would become statute, and statute would have precedent over the regulatory change. So there were some technical questions on exactly how that implementation would play out. There were no clear answers. So kind of as a broader coalition, there was consensus around it would be better to not maybe hold off on the narrow version of TROA and see what other approaches we can take in the next Congress, in the 119th Congress, to continue to advocate for that change, because we very much want the bill to continue to be debated and ultimately passed, even if the proposed rule is finalized. Because I'll take a minute here and just explain that for those of you that are not in the policy circles with us every day. The proposed rule is a tremendous policy reform, tremendous policy win for us for access to care for obesity treatments. Because it's going through the regulatory process, it is actually subject to change with any administration change. So if the new Trump administration were to finalize it and the coverage is there, it is possible for the next administration to come in and change the coverage. Now, if we pass TROA and that is then statute, they wouldn't be able to make those changes from a regulatory perspective with a change of administration. So it's called codifying, and that's really important. We're going to continue to advocate for that as well. So these are some of the questions that we have been discussing since the proposed rule has come out. Just looking here at some of the Q&A that's come in from participants. Thank you so much for asking additional questions. Laura is mentioning here that another webinar that discussed the proposed rule emphasized that volume of comments was going to be key to making sure the incoming administration saw the strong support for this and would uphold this rule. While you are emphasizing quality over quantity, do you think the incoming administration is likely to uphold this or overturn the rule Do you agree that the volume of comments is important? Volume is important for sure. That's one of the reasons why we are holding these webinars, to encourage people to write in. However, a unique comment holds kind of a little bit more value than let's say a flood of 50 form letters that say exactly the same thing, the templated form letters. If 50 of those come in, they will kind of group them or bundle them as like one. However, if we get 5, 10, 20, 30 really unique, powerful personal stories, very provider testimonies, clinician examples, they really look at every single one of those. So they do, there is an added value to those unique statements as well. Let's see here. Sarah will be following up with a bunch of information. Patty's mentioning, okay. So for Patty's comment here, talking about if the provision survives into the final rule, doubting the rule will be finalized in the next calendar year. So the positive aspect of this proposed rule is that some of the other provisions of this rule have to be finalized this year. They include updates for the Medicare Part D plans, Medicare Advantage plans, for the new Medicare drug payment program under the Inflation Reduction Act. So some of parts of this rule have to be finalized. And typically, looking back at previous years, this rule is typically finalized end of April, early May, so that the Part D plans can update their coverage policies for the next plan year for 2026 in this case. So that's a positive position for our particular provision to be included in this proposed rule, because there's general consensus from the policy and legal community on this particular rule that it will likely be finalized this year. Another question, will all medical plans be forced to follow these rules, or will this just apply for Medicare Part D? So this particular rule will apply for Medicare Part D. So for those that are age 65 and older, or for those that qualify living with disabilities, and also for state Medicaid plans. So, and that's not, for each state's eligibility criteria for their Medicaid beneficiaries. So both of those populations. However, what we know is that when CMS makes a policy change, most other payers follow suit. So that has been why this particular type of policy change has been a priority focus for us for many years. So not directly, to answer your question, it doesn't directly affect the way commercial payers or employer payers coverage policies. However, we do expect it to have an indirect effect. Okay. Another question here. Can you please explain more about the process of CMS of approving the proposed rule? Does it have to pass through any other branches? No, great question. So the proposed rule, we're in the public comment period. This will close the end of January on that 27th. Then what happens is that the staff at CMS, or sometimes they contract out for it, will collect and review all of the comments and collate them and categorize them, and then assess how the proposed rule, if there need to be changes and edits and updates, and then they essentially create a new draft, which is the kind of pre-final rule, And then that has to go through a couple of other steps to go to different government offices. The Office of Management and Budget has to take a look of it, which is the kind of the budget arm of the president's office. They have to take a look at it and go through some final review and finalizing that. And if that is approved, then it comes back over to CMS, and then it would be issued as final. So there are steps of the rulemaking process that this definitely still has to go through, but that it stays within the government agencies. I believe we'll be happy to share the slides. Yeah, and then one last comment here. It's also recommended to contact federal representatives and senators. We always welcome folks to reach out to their members of Congress and express their support for policy issues. So that is always welcome. And then we will be doing some additional advocacy from OAC as an organization, as well as many of the OCAN member groups, our broader coalition, to work with Congress to have members of Congress express their support for the proposed rule as well. So we'll be working kind of these parallel advocacy strategies once the 119th Congress is kind of up and going.
I think that's most of them, Tracy. I went ahead and oh, there's one just popped up. Sorry, I did go ahead and answer some, typed the answers and put them up. I'm not sure what you can see. I especially appreciate the person who suggested doing a QR code. So I figured we can easily work that into the one pager we have ready. And we're going to have several documents to help people.
So this last question here, is there any possibility that a Part D plan may get passed in 2025? Not with how the proposed rule is written. It would affect plan years starting in 2026. Medicaid plans could change their coverage because they already have the authority to determine if they want to add coverage or not. So we could possibly see some changes in Medicaid prior to the rule being finalized if this provision remains.
It looks like there's one more from Kathleen.
Yeah, okay, great. Yes, thank you. Does the current apply to pre-diabetic conditions as preventive care? I don't think this would, if someone is living with obesity and met the criteria in that regard as well, then that should be captured.
Tracy, if I can add, because I know you talked about Congress possibly codifying this law by TROA and reintroducing it. So I just wanted to the question of, is there any possibility this would get passed in 2025? Even if Congress were to pass something in 2025, the effective date usually is not immediate. It's usually the next plan year, even farther out. So yeah, to have anything take effect for 2025 is not likely. Again, as I mentioned, currently there is the indication for cardiovascular risk reduction for patients who have had a cardiovascular event with obesity. So that is a possibility. And if the FDA does approve some other conditions, but again, that is patients have to have that condition along with obesity in order for the plan to cover it. And we are really working and fighting to have all patients with obesity to have this coverage.
Yeah. Thanks, Sarah.
Do you want me to take a couple of these? Some just popped in.
Oh, okay. Sure, go ahead.
I don't necessarily Alexandra's. I don't necessarily have the success rate of proposed rules when the administration turns over, but I guess this will be the time to, if it's okay to toot my horn a little bit. So I have seen proposed rules propose a certain type of criteria, and um, with the influx of public comments and patient stories, get a finalized rule that was even better than what the proposed rule had. So this is very much why I emphasize on getting patients to, submit their stories and the reason why they need this done. That wasn't at a time and place of a turnover of administration, but it does show the value of the public comment period. As we said, it's the opportunity for everyone in the public to have their say on a proposed rule. And again, CMS is reading all of these, and they do really take into consideration what is being said in them.
And I would just add to that, Sarah, and this kind of goes back to Patty's earlier comment that when a new administration does come into office, they will often either freeze or sometimes withdraw proposed rules that were recently released. The outgoing administration sometimes rushes, or often rushes, to get a lot of things out the door. And in DC, in the policy world, we call those midnight rules. And so when the new administration comes in, oftentimes they will kind of freeze them and take a look at what has been released and decide on which ones they want to or need to move forward or not. Some do move forward. I have a pretty decent level of confidence that this particular proposed rule will move forward. We just have to ensure that Section 4 for the obesity medication stays in there. But there are other proposed rules that will just probably never advance, and or be withdrawn. So that is a possibility with an administration change for sure.
Okay, I think I have, replied to some people questions privately, given my contact information, which kind of leads us to the next. Oops, did not mean. Well, I've lost that. I get. There we go. So if you need any help composing your comment, we are here to provide that guidance. And you can email us at advocacy dot or not dot at obesityaction.org with any questions or for additional assistance. If you want to have a draft and run it by us, be happy to take a look at it. If you're really kind of stuck on what to say, I'll be happy to help you also. We do have an access reporting tool, and many people have submitted access issues through that reporting tool. And so I know our advocates have the ability to, say what needs to be said to people who matter. So again, I want to encourage everyone to, if you're a provider, encourage your patients. So again, I appreciate the idea of having the QR code to hang up. We need everyone. So as Tracy mentioned, yeah, quantity is important. It's just we want to have that quality too. So we want to do everything possible to help people compose a unique comment and submit that. So Tracy, do you have any final words?
No, that was really great, Sarah. I just also mentioned, our good friend Chris Gallagher is also available for questions and support during the this comment period as well. And really just think of us as a resource, and reach out at any time. And thank you all for joining us tonight. It's great to be with you.
And again, I will send out slides, the step-by-step instructions. We will be having another webinar. It'll be similar, same topic in case there is anything else that does pop up, and that'll be January 9th. And we will also have a video available in January that can be shared for anyone who hasn't been able to attend either of the webinars. And with that, again, thank you all for taking time out of your evening this evening and joining us. And um, just remember to enjoy your holiday and work on the comment before the 20th of January. So we have a little bit of time, but we definitely want people thinking about it. And we know people were very interested in learning more about what the proposed rules stated. So again, thank you all and have a good rest of your evening.